Welcome back, everybody. In this episode of Mighty Explained, we're going to be talking about internuclear ophthalmoplegia. And this is pretty much a problem with the eyes. And when you look to your left, you look to your right, you need two different nerves that work together to make that happen. Why is that? Because your lateral rectus is innervated by cranial nerve number 6. Lateral rectus allows you to look laterally towards your ear, right? And then your medial rectus allows you to look medially, and that one is innervated by cranial nerve number 3, which innervates the medial rectus. So these two have to work together so you can look either towards your right with both eyes or towards your left with both eyes. So take this patient here, for example. This patient, if you're looking straight at him, and this is a beautiful nose that I drew, this V right here is supposed to indicate a nose. I know. Please don't judge me. But anyway, so this patient is trying to look towards their right. And what happens is this eye right here, which is their right eye, is looking towards their right. So that's laterally. But the left eye isn't looking laterally. It's looking towards the nose, towards the midline. So this eye is looking medially. Okay, so that's why these have to work together. Cranial nerve number 6 and 3, because they innervate the muscle, the lateral rectus, to look laterally, and 3 innervates the medial rectus to look medially or towards the midline. All right, so the connection between these two is called the MLF, or the medial longitudinal fasciculus. If there's a problem with that, if it's lesion, then you have an internuclear ophthalmoplegia. Internuclear, the two nuclei 6 and 3, ophthalmoplegia, eye problem. All right, let's move on. This is an easy schematic right here that just shows how things work. Here's cranial nerve number 6. This is the nuclei with the circle. And this is 3, which is circled here. Now, say this patient wants to look over this way because there's something cool going on over here. So this is a bird's eye view. You're looking at the top of someone's head, and they're trying to look to the right. So cranial nerve number 6 is like, okay, you want to look to the right? I got you. I'm going to go innervate the lateral rectus right here. Lateral rectus. And at the same time, I'm going to send a signal to 3. Hey, I need you to activate your medial rectus, which is on this side. So you can look this way, and you can look this way at the same time. Now this is the MLF, this roadway between them, this connection. And if this is lesioned, then this eye can't rotate, and it just gets stuck because this isn't getting any signal. So it gets stuck, but this bad boy right here will move laterally. So you have an eye over here. I know this is going to look kind of ugly, but this eye is going to be able to look laterally. This one is going to get stuck and won't be able to look medially. Let's see what that looks like, and let's see if you can identify the different types of INO. Okay, now how do you name them? Easy peasy. The eye that gets stuck is the way you name the INO. And this one right here is the left eye if this patient's looking towards you now. Okay, this is their nose again. This patient's looking towards you. This eye is getting stuck when this patient's trying to look that way towards their right. That means this is the left eye, so you have a left INO. This one right here, this patient's trying to look towards their left. Okay, so this patient is able to abduct or look laterally with this eye, but this one gets stuck, and this is their right eye right here. So this is a right INO. So the key is the eye that gets stuck is the one that you use to name the internuclear ophthalmoplegia, and this is how it looks clinically. So if a patient comes to you and you're like, hey, follow my finger, and you do this to make them look towards their left side, and their right eye gets stuck, that means they have a right INO. And that's pretty much internuclear ophthalmoplegia in a nutshell. And if you guys have any questions, put them in the comments below. I hope this helped. Don't feel confused, or, you don't feel confused, you just become confused. But if you are confused, don't be too hard on yourself. This is somewhat of a difficult concept, but if you go over it a few times, I promise you'll get it. All right, thank you, and I'll see you in the next one.